We are doing Juvederm Ultra today, and there's so many options for non-surgical rhinoplasty. This is a great product that we can use on the nose. There's other hyaluronic acid fillers that I also love to use on the nose, but this product is made by Allergan, and it's a hyaluronic acid filler. It's been on the market for a long time, so it has a lot of longevity and history behind it. We're going to be using it today for the lips and for the nose. So I'm going to show you, demonstrate today how that's injected. Right. So I like to inject the bridge of the nose with a needle. Some people do it with a cannula. The cannula, I think, everybody has their opinions about whether a cannula is safe or not. In my opinion, as long as you do a very slow technique, slow injection, and the needle is right on the bone, you're safe. If you do go right under the skin, then you should be going very slowly and withdrawing on the needle hub. I also like to use a 32 gauge TB syringe because it makes it very precise. So I'll go over both of those techniques. This is a 30 gauge needle, and that means it's one of the smallest needles, but it's still not the smallest needle, but it makes it very comfortable for the patient. So we're gonna just go right here. You felt that tap, right?
Mm-hmm.
A little bit of a tap. I'm gonna take my time. You'll see it kind of build up underneath the skin. And then I'm gonna stop. So I barely injected anything. It's less than 0.05, so very small smidgen. 1 milliliter of filler is equivalent to 20% of a teaspoon. So it's very small. So what I just did there is like a drop, right? If you think about that, the syringe is 1/5 of a teaspoon. So what I just did is just very, very small. And I take my time going in and going out so we get less bruising. I stay right in the middle, and everybody's different. I sometimes go out on the sides, particularly if they have a bump out on the sides. I'm doing this injection so everybody can see on the video what I'm doing and how the injection's done. I see my patients back about 2 weeks later, and that's because there's swelling at the time of the injection, and we might have to do a little adjustment, particularly on the bridge of the nose. The tip takes very little adjustment. The tip usually looks pretty good, but the bridge of the nose, since there's swelling, and then it's at the top of the nose, it can drop down. No sunglasses for a day.
Okay.
That's what I've been telling my patients. Although I didn't tell them that in the very beginning. I didn't do that, and I think that affected some people. But the longer you can go without wearing the sunglasses, probably better, so that the filler gets to settle there. Doesn't migrate, because it's soft, right? The filler's soft. So if you put on sunglasses the same day, you're probably shifting it